Implants are a little bit different than teeth. You need to take care of them. You need to brush them, floss them, use pictures, all that, all of the above. But they can be more susceptible to certain form of periodontal disease called peri-implantitis. It's an inflammation of the tissue around the gum tissue. Now, the bone itself, the implant in the bone could be fine, but the tissue, the gum right around where the implant and the tooth meet is inflamed. It tends to bleed easily. It's hard to keep it all nice and clean. And that is the person who is perfect candidate for our LAPIP treatment. LAPIP, using our laser, that same laser that we use in LANAB, it stands for laser assisted peri-implantitis procedure. We can help control the bacteria. We can get rid of peri-implant disease, kill the bacteria, get that tissue nice and healthy so that implant's going to last considerably longer. We got involved in using the Millennium MVP laser back in 2010. And as we were able to see how effective it is for treating teeth, we also realized, kind of by accident, in treating an implant which had some inflammation, that, hey, this is going to work great for this too. And we were able, so it was an aha moment where we saw that the technology that we had focusing one way could just as easily focus just slightly down a different pathway and help preserve implant complications. Now, dental implants, there are millions of them placed every year across the country. We pride ourselves on having a 98% success rate, and that's great, but that means that 2% are going to have issues. We're going to have problems. We're going to have to deal with that. General dentist success rate is more like 75%. So there's a lot of implants that are out there that are going to need to have some care. They're going to need to become a little bit more healthy to survive so that people can use these for smiling, for talking, for eating into their golden years. A patient has a failing implant. The traditional therapy has been to do a surgical flap and get in there and mechanically try and clean the root surfaces. These root surfaces have threads on them, sort of like a little screw. That's how they're placed. And these are little nooks and crannies for that bacteria to hide. A mechanical debridement isn't really that effective, and that's why we've had limited successes with traditional therapy. However, when we use a laser, we can use light energy to enter and kill the bacteria on the implant surfaces to allow a regeneration to occur. So we're going from a mechanical means to a light-based laser means of decontaminating the surface, which is way more patient-friendly, easier, and helps us prevent the ultimate problem, which is really removing a failing dental implant. As long as that implant is not moving, as long as it is stable in the bone, we have a good chance of us being able to kill the bacteria and stabilize it so it's not going to get any worse, and we can maintain that implant in health going forward. One of the most difficult conversations we have with our patients is the fact that they have an implant that was placed years ago, who knows where, and now they're having problems with it. And they had been under the impression that this was a permanent solution, and now there are difficulties with it. So we are trying to address them in a most simplified manner. If we can leave that implant in place, if we don't have to remove the crown or the bridge, which is placed on top of that, and we can get rid of the infection, this is going to be much more cost effective, much less trauma involved of us removing a dental implant, regrafting, and starting all over again. In terms of comfort and the recovery time for our patients, we have found that the LAPIP treatment of dental implant problems is very similar to the LANAP treatment of teeth-based problems. There's minimal discomfort afterwards. There's less swelling. There's reduction of inflammation in the area, and it tends to heal up better, faster, quicker than more traditional open flap debridement procedures.